We have been doing lots of studies involving the congenital Zika syndrome, and we have seen that these babies, they have not only neurological findings but also ocular findings. Now these babies that were born last year in October, November, December, we are following their vision, and we're seeing that they are visually impaired, and we are assessing with rehabilitation, magnifying glasses, patching, and all of that so that they can have a better vision. The association between Zika and the microcephaly has been established. So we know now that it's a new entity, and it's called congenital Zika syndrome. It not only involves the neurological findings but also ocular, hearing deficit, and skeletal findings. So these patients, they can have moderate to severe hearing deficit. In the eyes, we see mostly that the virus affects the optic nerve, the retina, and the vessels, and the most common and typical finding is a scar in the macula, and this scar can be associated to pigmentation mottling or not. The nerve, usually you can see optic nerve pallor, you can see hypoplasia and increased disc cupping. And the vessels, you can see vascular attenuation and hemorrhages, vascular findings like in peripheral findings as well. So it's a broad spectrum what we're seeing, and of course the neurological findings, these babies, they have lots of seizures, the microcephaly is severe, big ventricles, calcification in the brain, and the calcification is very interesting because it is different from congenital toxo and congenital CMV, that the calcification in Zika, it's generally subcortical and periventricular. So this is another interesting finding in congenital Zika syndrome. The skeletal findings involve the arthrogryposis, clubfoot. They can have the hip subluxation. So it's a very broad and rich new entity. We are learning a lot with this new disease in Brazil, and now, of course, it has just reached the US. Now we have cases in Florida, and we have evidence of pregnant women infected in Florida. So about 150 pregnant women are expecting babies, and they were infected during their pregnancy, and we still do not know if they will have ocular findings or other neurological findings from the congenital Zika infection. It is estimated only with models. We still do not have a prospective study. We are starting a prospective study. CDC is actually starting with NIH this new study called ZIP study. It's Zika in infants and pregnancy, where they are doing a prospective study and seeing what are the chances, and I'm sure in maybe 1 year we'll have that answer, but the estimate that we have now is between 1 and 13%. So it's a really broad percentage, but this is what we have now. What we know is that the virus has been detected in the semen of men up to 6 months. This was the most time that we have seen that the virus maintained alive. This is not usual, but what CDC is recommending is that the women in childbearing age that wants to get pregnant but was exposed, or their partners were exposed to Zika, they should wait at least 6 months to get pregnant. In Brazil, there's a big difference from the US because we were not expecting the disease. We had no information whatsoever, and we were stricken by the virus, so we just had to go with the flow and try to understand the virus, the disease, and not the effects of the disease. It was really overwhelming, and I think the United States have now another point of view where and they had the chance to get prepared. They have the information, and I think they have been advising pregnant women and avoiding pregnancy, and at least recommending people to be more careful and avoid being infected. So I think it's just different because we were not expecting, and the US is prepared to, or at least is trying to be prepared for the infection.